Hello everyone, welcome to this audio podcast, and in this following on from the Bostix rupture, Bostix rupture, and the Bostix feature that had that had sort of that had taken place after one of the previous audio podcast series, or part of one of the audio podcast series aligned to the lab storm effect v3. What I thought I'd do here is sort of another feature aligned to the Bostix feature. So this is an audio podcast aligned to the Bostix feature 2, part of the science audio podcast around the science of Traption, and an audio podcast part of the Bostix rupture. But the Bostix rupture, this is a chartered edition and another evidence-based edition, a part of Storm the Bostix production. So what I thought I'd do here is basically talk about or highlight some pivotal aspects in around a particular sort of condition, if you like, and wherein I sort of look to sort of highlight some particular answers to particular and important and significant questions in around this particular a particular condition. And at the end, toward the end of this audio this audio podcast and the Bostix feature 2, what I'd look to do is outline or highlight some references in line to where listeners are more than welcome to check out sort of the resources which will be highlighted on social media aligned to this particular audio podcast. So this audio podcast will focus on chronic kidney disease and CKD education, and where we look at answering particular questions as well. So as part of this audio podcast, Science of Traption, I thought so in line to this and in line to what we're going to sort of talk about or highlight, where I thought I'd take this opportunity sort of to get into this. So one of the main questions, or one of the pertinent questions that sort of come around in around this particular condition around chronic kidney disease or CKD is for example what is chronic kidney disease, or what is CKD? So one of the ways that I thought to answer this question in part of this audio podcast is perhaps in context aligned to both CKD in pediatrics and young people, but also in adults. Now, generally, it's been construed sort of in an unfortunate way, but at the same time, in some contexts, understandably, that CKD or chronic kidney disease has a sort of a forbearance on sort of the adult population, and in certain parts of the world, there is a prominence in around the epidemiology, the incidence and prevalences around CKD in the adult population versus pediatrics, and primarily owing to the chronic kidney disease being more sort of where there's more of a prominence in around the adult population, owing to the adult population being generally in a majority in context of population health, versus, for example, pediatrics and young people who tend to be a sort of a minority. So the question again, what is chronic kidney disease? So CKD generally, or chronic kidney disease, is a complication, is a health complication from pediatrics. In pediatrics is from for example, can be from complex etiology and pathology, and in between sort of pediatrics and young people and adults, is complex in context of, can be complex in context of primary comorbidities that sort of everyone tends to know about. In line to this, at least in context of the and around the sort of adult population, ultimately becoming sort of multi-systemic, owing to primary comorbidities and sort of the complications the complications that are part of those sort of primary health conditions. Now, in children and young people in pediatrics, and young people, CKD etiology tend to originate for several reasons, of several bases. So, for example, from congenital, hereditary to endocrine, and physiological complications. And owing to the nature of the disease, CKD patients also encounter various national health services. For example, such as laboratory tests and investigations. And at the same time, CKD patients or recipients are also prescribed, or can be prescribed, several medications throughout the disease pathway. For example, and wherein in around the disease pathway, wherein in around the sort of disease pathway where medications can be prescribed, are based on and in around and irrespective, for example, whether recipients with CKD are, for example, pre-transplanted and or post-transplanted, for example. And at the same time, CKD patients are being prompted more so now, or more so sort of more so in around owing to a basis that information in around CKD or chronic kidney disease and information sort of information online through for example search engines online, etc., are being prompted to sort of take ownership of aspects in around disease and disease pathways. Patients, at the same time, evidence indicates or informs that patients and recipients want more face-to-face understanding of sort of tests and investigations, or at least where, for example, where health professionals themselves can be part of, for example, online discussions, and for example where health professionals could be and should perhaps be part of those important discussions that take place through for example social media platforms, wherein recipients tend to sort of share lived experiences, etc. And so in around this as well, that one of the things CKD in around this as well is where healthcare professionals, if for example are online for patients or recipients through sort of social media platforms, etc., then in that way it allows recipients or patients and health professionals to actually prompt and allow sort of a basis in where there is a sense of more rounded or more sort of robust care or healthcare, where recipients through sort of sharing lived experiences, and health professionals being online, for example, can actually look to help recipients and patients in around aspects of healthcare through for example an educational from an educational basis, if not for example direct clinical or direct medical, but at least in so much as that that recipients and patients going through the conditions can share lived experiences with those health professionals applicably. By improving patients' understanding and education relating to those important, for example, laboratory tests and investigations that surround chronic kidney disease or CKD, this will also reduce inequity of care and improve the health of the CKD, chronic kidney disease population. So that hopefully that brings into some basis around what is chronic kidney disease, as answering one of the sort of initial questions. Now, question 2 is around this is what are the main issues surrounding educational support? What are the main issues surrounding educational support for CKD recipients or patients right now? So to answer this particular question, support for recipients with long-term conditions or long-term conditions like chronic kidney disease or CKD can be sort of ascertained. Through a variety of mechanisms, and more importantly, where there's a variety, whilst there is a variety of mechanisms in around this as well, recipients and patients can and should expect where there's a variety of mechanisms of support for support in and around aspects of chronic kidney disease or CKD. At the same time, the mechanisms that are sort of available, or the mechanisms that are available, and also where for example lived experiences are shared. At the same time, patients and recipients should expect that sort of interplay between health sectors, because nothing is more important than where patients and recipients actually gain aspects in and around understanding aspects around their healthcare, but not just restricted to particular health sectors. What it should be is that recipients or patients should gain an understanding of aspects around the disease, so that to the extent and to a such that for example, if there are issues in around some aspects of healthcare that pertain to CKD that are in, for example, in secondary care, then it's important that the recipients or patients, if for example that the recipients or patients require aspects of care that align to CKD, perhaps in around primary care, then it should be a case that recipients and patients have that sort of fluidity, such that the care between healthcare sectors have a sort of fundamental basis and interplay, so patients can sort of take a fundamental ownership in around aspects of care, and to the extent where patients, recipients, and of course health professionals sort of gain a sort of an advantage and a basis in around CKD, so that there's a sense of alleviation, a sense of an alleviation and impact, so that patients and recipients and health professionals actually don't, for example, where traditionally, where traditionally it has been documented and evidenced that patients go to health professionals, patients would go to health professionals with particular requirements in around aspects of health, and health professionals would provide aspects of an aspect of treatment or care in around whatever a condition or health aspect might be, but at the same time, where that traditional sort of aspect of care has been, is where patients or recipients would go to health professionals, and for example feel that it would be it would be appropriate that they follow the direct instructions of health professionals without, for example, questioning. And not to say, of course, it's not to say that health professionals and the way aspects of how they practice and do things would be sort of misaligned with guidance and frameworks and sort of practices. But at the same time, there should be every opportunity for recipients and patients to have that sort of opportunity to have dialogue. So, for example, if a recipient or patient says, for example, that they've tried something and it hasn't worked, then it should, and then health professionals say, for example, can say, well, for example, from the evidence or from literature, for example, this is what sort of guidance informs and highlights. Perhaps try such and such, for example. Now, at the same time, around this particular question, and one of the main issues issues surrounding educational support for CKD patients right now. At the same time, the patients and recipients, whilst sharing sort of aspects of care through lived experiences through online or through social media platforms, for example. At the same time, patients going through particular conditions should at the same time have an attitude and a mindset in keeping and aligned to health professionals, if not better, because at the end of the day, this also means that patients who are going through particular conditions are going through those conditions, not the professionals and not the health professionals themselves. And so, for example, it's appropriate and applicable that patients and recipients, for example, have sort of a basis in around where they can access sort of the literature, for example, around aspects of healthcare, so that they can have, for example, those important discussions with health professionals, and especially, as per mentioned, patients or recipients may see several members of, for example, a multidisciplinary team or MDT at varying times, and may also receive sort of sort of misinterpreted aspects around their healthcare as well. And especially since for at least some time, there's been a basis where health professionals can where health professionals can and sometimes for example, in around what might be inferred as sort of aspects of best practice, can tend to highlight aspects around sort of around aspects of the condition that recipients or patients might be going through, only to find that those health professionals can be talking or highlighting aspects or supporting patients or helping recipients in aspects of the disease pathway the disease pathway, whereby, for example, if they're a health professional from one particular sort of professional basis, then at the same time they could be, for example, providing understanding or a basis in around the basis of another health professional's background, another professional's basis, and in this literature again informs it is why where recipients and patients tend to have whilst there's a sharing of lived experiences through social media platforms, for example, there can be problems or issues because the health professionals as they are tend to look at aspects of the disease or the disease pathway and provide a basis, at least traditionally, where they provide a basis in around more than one aspect of the disease pathway, and so hence again why lived experience is online or through for example social media platforms or other media, for example, media or bases, therein why certain questions, certain aspects around the disease pathway are sort of repeated and highlighted, and unfortunately cannot, where patients or recipients shared that sort of understanding, unfortunately may not get a complete sort of answer to aspects of their healthcare, unfortunately, and thus again is why varying health professionals should be sort of online, and where online view that as a way of in conjunction, if you like, in conjunction with what is done in physical spaces as well. So on from there, one of the next questions, in this particular audio podcast is, what mechanisms of educational support exist? So where patients would normally see more than one health professional, identifying and having access to peers to help inform shared decision making is advantageous. But further to schedule online consultations, for example, with those who are trained to provide remote educational and services is or has become sort of more pivotal, owing to the way both patients and health professionals how patients and health professionals are involved in aspects of healthcare. For example, on a sort of day-to-day and online support, and so for example as an example, in this context, there's the kidney, what's known as the kidney disease and renal support group, or KDARS, for kids, which has been a social media platform to improve CKD awareness since in around 2014, and the renal patient support group, the RPSG, since in around 2009, and evidence. So the evidence sort of indicates or informs that empowered patients or recipients tend to be more probable to make informed decisions surrounding healthcare choices, And so education in context of healthcare education is also important, is generally an important mechanism. But apart from that, to highlight and align to I'm referring to sort of question 2, it's where patients and recipients, apart from sharing lived experiences, there has to be a basis where, or there should be a basis where patients are able to interact and link sort of aspects of their healthcare in line with literature, because at the same time what sort of history or traditionally what has been documented is that, for example, in context of literacy or health literacy, for example, is that patients or recipients, for example, do not communicate in sort of clinical or medical terminology, and this is where health professionals and patients or recipients, and again, irrespective of whether in pediatrics or young people, or in around the adult population, for example, is where in this disease, in around this particular disease or particular condition, is where both patients and recipients should be seeing ways to sort of support aspects of healthcare, rather than in silos, in a way where there's a sort of a joined up thinking basis, and where in context of clinical and medical from a clinical and a medical basis, for example, where health professionals should be providing patients and recipients with a basis around the literacy, around literature, since a sort of a long time sort of aspect around different sort of aspects of healthcare, is where there has been a basis where professionals in parts of their works, in parts of their day-to-day practice, for example, from their day-to-day practice, for example, is where communication is one of the most pertinent aspects of sort of clinical and medical sort of care, and so in line to this, and what mechanisms of educational support exist, we know through, for example, apart from social media platforms, it is known, for example, that through the World Wide Web or the internet, for example, there's various search engines to actually ascertain evidence-based sort of literature around different aspects of disease and disease pathways, and so it's pertinent that health professionals themselves actually are whilst they're acquainted with literature, it is actually important that health professionals share that literature based on different aspects of the disease pathway or condition, or whatever the particular aspect of healthcare is being queried by a recipient or patient, that the dialogue should be evidence-based, so that patients actually do become those kinds of health professionals, patients or recipients that actually are sort of in par, and also in context of dialogue, are able to communicate on a similar basis, so that when aspects of care are actually documented, that in sort of what's been known as electronic patient records, or EPRs, for example, that the patient's healthcare is documented on a basis that can be referred to and coded in sort of clinical and medical sort of terminologies, if you like. So that's that's some of the sort of mechanisms in around the support that sort of exists, but also hopefully sort of some of the mechanisms of what can be sort of interplayed in sort of prospectively. So another question is question 4, for example, is education support around, for example, the science of CKD or chronic kidney disease important? So to answer this particular question, there is works one thing on this basis. I would like to provide a sort of context wherein whilst it is to be understood, is to be understood and appreciated that whilst for example healthcare professionals that are referred to as scientists, for example, do not sort of train to have sort of that sort of physical clinical involvement in aspects of practice or healthcare practices, and aligned to patient care. They do have an unused knowledge base, for example, wherein recipients or patients and other colleagues and health professionals in other aspects of health and other aspects of healthcare can find there's an aspects of advantage in around this. So aligned to this as well, there tends to be a sort of a fundamental requirement, at least in a fundamental requirement in at least sort of today's National Health Service, NHS, in so much as to involve diagnostics with the rest of medicine, and to sort of make crucial layman sort of basis available in a timely manner to line up with saving lives. And so the question in around this question again is education support around the science of CKD, chronic kidney disease, important? Yes. In lots of ways. And as per answered in one of the previous questions, what tends to happen, or what can happen, or what has happened sort of historically or traditionally, is that different health professionals can be involved in aspects of patient care, or patient care or recipient care. And then what happens, or what can happen, is different health professionals at the same time, for example, who for example, have maybe a little bit of an understanding or a basis around some of the sort of the scientific or science basis around a particular or specific health and disease or diseases and different etiology and pathology. Generally, the issue is that these different health professionals that can be involved or can be involved tend to actually is sort of where they get where they tend to have a sort of a sort of a leaning into other health professionals, other health professionals who for example are trained in sort of aspects of practice and are not sort of, for example, where other health professionals may not or should not be sort of sharing different aspects of for example in and around tests and investigations that take place in the laboratory, if for example their health profession, their professional background is indifferent of that. So as a typical example, so for example, those who have a basis in around a sort of a nutrition aspects of nutrition and nutrition health, then in around aspects of nutrition health, they should not be those who are nutritionists and see themselves as experts around nutrition should not be sharing any understanding in around aspects of for example the pathologies, the aspects of pathology or the sort of investigatory aspects of the disease, for examples, and so in line to this as well, it is important that as sort of a basis that health professionals, again, different health professionals and patients and recipients are involved in sort of a more joined up thinking in around aspects of sort of the disease pathway. So the another question around this is another basis in around this is for example the implications to practice and research. So for example whilst some aspects have been highlighted and sort of shared here, one of the things is also what are the implications, for example, what are the implications to practice in context of practice and research. So educating healthcare professionals about the importance of, for example, the recipient's or the patient's role and how to sort of interact with patients is another sort of main area of investigation. And in line to this, there's some literature and some literature and investigations that have sort of delved into the basis in around this, and evidence also indicates that healthcare professionals are using for example professional or expert language or technical sort of terminologies without patients having sort of knowledge basis in the first instance will and can continue to act as act as issues and barriers to communicate to communicate, and also in line to aspects of healthcare, or what something that I would refer to as healthcare sort of transparency. So targeting the attitudes and behavior of providers through potential solutions is important, so that the sort of associations and relationship between sort of the patient, the service users and providers is sort of balanced and smarter. So altogether, sort of the summary is the sort of summary in around this audio podcast, as in context of the science Traption and the Bostix feature, the Bostix feature 2. The summary around this is that a collaborative patient or recipient centered practices are designed, or should be designed, to promote the active participation of each discipline in aspects of patient care. Collaborative working enhances mechanisms for continuous communication, and optimizes staff participation in aspects of decision making within and across disciplines or specialties, and also should foster respect for disciplinary contributions from all in that context. And so that sort of closes in on this sort of audio podcast, the Bostix Rupture, the Science of Traption, and where this audio podcast is a chartered edition and another evidence-based edition. And sort of before finalizing or closing on this audio podcast completely, some of the literature that can be highlighted is works by, for example, Mohammed and team from 2014, in around the works in around some aspects of the works of the Renal Patient Support Group, the RPSG, and supporting patients with chronic kidney disease through social media. And there's a publication that is sort of accessible. And there's works by Mohammed and team as well, looking at aspects around chronic kidney disease from pediatrics and young people's pediatrics and young people, sort of and a focus, and where the work was published in 2016. There's also works from Mohammed and team in another publication in 2016, relating can social media help raise sort of discrimination and ignorance awareness of people with long-standing conditions, providing a CKD CKD example, and aligned to sort of assistive technology for people with disabilities. There's works by Mohammed looking at sort of aspects in around in aspects of what's been referred to as polypharmacy and influence of renal polypharmacy and influence on renal insufficiency in elderly care as well. And the works this works by Mohammed in 2020 looks at this works from a sort of a retrospective systematic review. There's works also by Mohammed and team from 2020 where they look at is there a need where they question where the colleagues where the team and the colleagues look at the the works by questioning, for example, is there a need for healthcare scientists and educational support surrounding chronic kidney disease, and looking at this from bases in around laboratory investigations and tests, and looking at this also by sort of summarizing sort of data from polls that have been conducted through the renal patient support group social media platform as well. And once again, listeners, these sort of citations or references will be highlighted on social media in around this particular the Bostix feature 2, so listeners are more than welcome to check out these sort of resources and sort of look to identify some of the works online. But once again, thank you for tuning in. This has been an audio podcast, once again aligned to another Storm the Bostix production. Thanks for listening in.